I've been looking over a lot of literature over the last few weeks on the best type of exercise to reduce blood pressure and help our overall heart health. And the results were actually really surprising to me. But I thought, why not look over the TikTok landscape and see what the TikTok world has to say on exactly that question. What is the best exercise to reduce blood pressure and help heart health? So let's get into it.
Hello again, I'm Dr. Jerry Tan. I'm a Mayo Clinic trained endocrinologist. For today, let's talk about what kind of exercise can help lower your blood pressure. We all know that blood pressure is one of the risk factors for developing chronic illness, including heart disease and stroke. In this recent study that looked at exercise training,
Let me stop real quick. This is actually one of the studies that I did an in-depth analysis on. I'm going to link my video in the description for you to check out if you actually want to see the data and actually see the breakdown of the study. Let's see what this doctor from the Mayo Clinic has to say on it.
and resting blood pressure, it showed that clearly different forms of exercise have different effects on lowering blood pressure. Aerobic exercise training, for example, dynamic resistance training, isometric exercise training were all found to be effective. But clearly, overall, it was the isometric exercise that significantly lowered both systolic and diastolic blood pressure. And the
So it's true. He's exactly right. The analysis did indicate that isometric exercise. So basically, you're contracting your musculature, but you're not lengthening or shortening the musculature. So it's staying in a very static position. And there's a number of different exercises that fulfill that requirement. If that's doing like a plank, or if that's a wall squat, or a hand grip test, or a hand dynamometer, or whatever it might be. And yeah, he mentions that isometric exercise is the best exercise, and it's true. So that analysis did find that. That was compared to what I really liked about this analysis, including another analysis that I looked at. What they did is they compared all of these exercises. I can't remember if it was this one or the other analysis. The one of them is what's considered a network meta-analysis, where they don't necessarily have to look at data of, let's say, running versus resistance training, and then resistance training versus isometric exercise. What they can do is, because they have a comparison of, they have one study that looks at resistance training and running, comparing just those two, they can use those values, and across a number of studies that look at those outcomes, those two different types of exercises. And through statistical modeling, which is beyond the scope of my knowledge because I've never done this kind of stuff, but trusting biostatisticians, which I tend to do, then they can do these comparisons against other studies that might just look at isometric exercise. And this actually allows for far more flexibility in how we go about meta-analyses. Anyway, that was a bit of a statistics rabbit hole, but the point being that when they compared all these studies, and I think it was like over 250 studies, which is an absolutely monstrous analysis. It's a lot of data. And isometric exercise came out on top when compared against basically every other exercise. Some of them were not statistically significant, but you could see kind of a trend towards a slight improvement, a better improvement with isometric exercise. So yeah, he's spot on. And these exercises that he brings up are great options. I will say, the one that was most promising was the wall squat. So just squatting up against the wall. Again, check out my video. It walks you through exactly how to do it and all that stuff. So anyway, good stuff.
Been a variety of randomized controlled trials and meta-analyses of these trials that have found people that work out and do more vigorous intensity exercise 3 to 4 days a week, about 20 to 60 minutes of vigorous intensity exercise, can improve their blood pressure similar to medications like antihypertensive medications.
Okay, so that was Dr. Rhonda Patrick. I do recognize her. I have looked at some of her content in the past, and she puts out really, really great stuff. Sometimes gets a little overexcited and maybe makes some statements that are a little bit beyond the reach of what the data says, if I may say. But beyond that, I really can't fault her because I have that same level of excitement, so I might be guilty of the exact same thing. Anyway, to her points, she says vigorous activity exercise, so probably more like high intensity exercise. It's true that high intensity exercise has kind of come up several times as being maybe slightly superior to kind of continuous training, so continuous endurance training. Those analyses that I mentioned earlier, they did look at high intensity interval training as well. They did not find it's not superior to isometric exercise. So while yes, so to be clear, yes, it does reduce blood pressure, but no, it does not reduce blood pressure to as great a degree as isometric exercise, or at least the data trends towards isometric exercise being a more potent blood pressure lowering effect. That said, the second thing that she says is that it can be as strong as some blood pressure medications, and she's absolutely right about that. So for isometric exercise as a whole, there's been about an 8-point drop in blood pressure. An 8-point drop in blood pressure is a massive drop. Then I mentioned that wall squats are especially beneficial, and that's because they have a slightly greater effect on blood pressure, dropping blood pressure by an additional 2 points, so about 10 points total. So imagine your blood pressure being 130 or 140 for your systolic number, that's the top number in your blood pressure, and that dropping down to 130 or dropping that down to 120. Those are massive changes, and again, isometric exercise doesn't take a whole lot of time, doesn't take that much effort. I mean, you're probably going to have to build up to kind of what's considered optimal. Again, check out my video on that. I'll put that in the description. But it's really incredible, and to have that with basically no side effects, and obviously there's going to be a host of other benefits that are going to come from it. While a blood pressure medication might benefit just blood pressure or might benefit just a few different aspects of health, but may also on the side may also come with many side effects for some people. So this is really a great PSA for people to just understand, hey, exercise, it just has profound benefits. And in this case, isometric exercise, although all exercises do drop blood pressure.
What are the most common lifestyle interventions? Let's say that someone does get to that 120 over 80.
Yep.
Where should they go first?
Aerobic exercise is an enormous way to lower blood pressure, as is weight loss. So weight loss is going to be mostly driven by nutrition and then aerobic exercise and sleep. Because I track my blood pressure pretty regularly, two of the most obvious things that show up when I'm not well slept is higher blood glucose and higher blood pressure.
Okay, so there's a very brief mention of aerobic exercise. That's Dr. Peter Attia and Chris something, I forgot his name. The point being that aerobic exercise is one of the ways that you can reduce blood pressure. And as I've mentioned, previously, of course, exercise of all types reduces blood pressure. So that's absolutely right. Would it be my number one? I think it would probably be my number two. Isometric exercise obviously being my number one. The endurance training, and then the type of endurance training, that's when you're getting into like, should it be high intensity or should it be continuous? The high intensity probably wins in that question. Then the scope extends to, well, what are other ways of dropping blood pressure? So let's just go ahead and address those, because why not also be beneficial in that way? The weight loss is absolutely going to drop blood pressure. That makes a tremendous difference. Probably, I don't know this for a fact, but I would guess that it probably has the greatest effect on blood pressure out of anything. Any intervention, it probably has the greatest effect. That assumes that a person is overweight. If you're not overweight, then maybe some loss of body fat may affect blood pressure modestly, but you probably don't have as much room to navigate. So in when I'm talking about weight loss having the greatest effect, I would say that's probably only in people that are like obese, for example, or severely overweight. Then he briefly mentions sleep. So sleep is not something that people consider, but sleep really has tremendous effects. I need to do a lot more research on it. I've read a good amount on sleep's health benefits as a whole, but in terms of the actual mechanisms, looking over the data and all that stuff, I'm still woefully behind on that. So what I have read up to this point in kind of generalities is it's true if you get a bad night's sleep, then your blood sugar tends to be higher, and it's true that your blood pressure is also increased. So trying to improve your sleep as best as possible. It's tough to do. For some people, it's incredibly difficult to do. Some of it comes down to genes, some of it comes down to circumstance, stress. There's all kinds of different habitual changes that can impact sleep. There's some supplements that can help sleep, melatonin, glycine to some degree. Some people have horrible experiences with glycine. Some people have really good experiences with glycine. Melatonin seems to be pretty consistently shows benefits for sleep, but it also matters how you take melatonin. Are you also stressed before bed? Are you, constantly engaging with your phone? Are you constantly engaging with work? Did you just exercise 15 minutes ago? Are you still is your body temperature up? Is the temperature in the room cold enough? Is it dark enough in the room? There's all kinds of different factors. So there's a lot to address. But as a whole, improving sleep will improve blood pressure. But if for some reason sleep is just not one of those things that comes easily to you, there are two other ways that you can reduce it through exercise and nutrition. I would say is definitely going to have the greatest effect on weight loss. I think Dr. Attia mentioned that. Anyway, there you go. So the takeaways, if you want some takeaways, is A, exercise as a whole will lower blood pressure, and B, the most effective exercise is isometric exercise. And I guess C, hopefully I don't have to go too far into the alphabet because I'm going to start forgetting my alphabet. C, I do remember C. C is the most potent type of isometric exercise, seems to be, at least based off the data we have so far, because there haven't been very many comparisons of hand grip and static holds versus wall squats. But wall squats seem to be the best, so aim for that. And again, check out the video in the description. Thanks for stopping by. See ya.